Okay, well, it's a real pleasure to participate in this video conference. We all are being affected by COVID. I think it's important that we share our experiences and learn from each other, in addition to the literature, because we are all in this together and all have things to learn that are new on a daily basis. As someone said, we are flying the plane while we are building it.
That will continue into the next topic of our discussion, child safety and infection control. How to protect the medical personnel. Can you maybe elaborate on that, on this important topic?
Yes.
Medical safety.
Yes. So we continue to have outbreaks. Actually, they've just announced outbreaks within hospitals. So even where people are aware and have access to personal protection equipment, there have been breakdowns in infection control and spread both amongst personnel and also between patients.
I will emphasize this in a second to Igrim, because this is also a very relevant issue for Kazakhstan. We just heard from Professor Lenz that even in Canada, there are instances of outbreaks meaning infection spread amongst medical personnel or between patients. And what do you think is the reason for that?
I think there's sometimes just small lapses in control is probably the highest. I would also say that some patients come in and are considered or tested COVID negative.
Okay.
And several days later, they retested,
yes,
and they are positive.
That makes sense. That makes sense.
I've just heard of examples like that. I think on this slide, the last line is very important to emphasize that just as you will have so-called hot and cold wards, so COVID positive wards and COVID negative wards, I think also it's important to keep healthcare teams also separated along hot and cold. And one of the ways that we've seen spread is that people have been working and going back and forth, say one day on a hot ward, one day on a cold ward, and this has caused problems.
I will, before Igrim, please hold on translating this. Before she will start translating this, I think in Kazakhstan situation might be different in that I believe I will get confirmation from our colleagues. I believe they assign specific medical centers to tending to those who are COVID positive. So basically, it's the whole center dedicated to just COVID. I'm not sure whether personnel transfers between both. Can someone please confirm this to me? Whether it's the whether I'm gathering the situation right? That in Kazakhstan, specific centers are assigned to COVID. Okay, so they are confirming this. So there will not be the situation when you have the same medical personnel going back and forth between COVID positive and COVID negative patients. The last is not.
Okay, and that's actually, if you can do that, that is excellent. Now, the level of protection that is needed, it depends on what you are doing. So, in particular, N95 type of masks should be reserved for those who are interacting with patients who are likely to generate aerosols.
So you would use N95 only for procedures that generate aerosol.
Yes.
Such as?
This could be nebulized medication.
So inhalation.
Inhalation. It could be CPAP or BiPAP.
Non-invasive ventilation.
Non-invasive ventilation. There was some debate about whether high-flow nasal cannula oxygen or air was aerosol generating. It is generally felt not to, but no one's 100% certain.
No one is sure. Professor Land summarizes his experience from Canada, under which situation to use the respirator mask, N95. He thinks that they use these masks only during the procedures that generate aerosol. And I asked for specific examples. It could be specific types of inhalation. It's called wet inhalation, non-invasive ventilation. No one knows for sure whether when a patient is given oxygen, high flow oxygen, whether this generates aerosol, no one knows for sure. And you also mentioned that to me in our previous discussion that the pulmonary function test is an aerosol generating procedure.
Yes, it is. And you're asking people to take in big breaths, breathe out hard. It often generates a cough. For those who have chronic lung diseases, it's aerosol generating.
Okay.